Hey everybody, welcome back to another episode of Daily Doc Talk. I am your host, Dr. Drew Timmermans. I want to talk to you today about a patient that we had on our clinical rotation that kind of highlights just the importance of making sure you're getting a full assessment by a physician, which includes hands-on assessment. So we had a patient come in who has had bilateral knee pain for, I think about the last 6 months. It all started after she was doing a Zumba class. Both of them started at the same time. So anytime I hear that, I always make sure that I think of the spine and how we can assess and potentially address the spine, because it's going to be a more centralized location that both of these pains could be coming from. And so we teased out, what kind of causes her pain, what makes it better, what makes her worse. And what we ended up finding out was that her pain was worse when she was in a deep squat position, which you could think of, well, yes, when we are in flexion of the knees with a load, that could cause knee pain. But at the same time, we also have to remember that there's more tissues involved in a squat than just the knees. Even though she's feeling pain in the knees, doesn't mean that that's where the pain is coming from, as there's other structures being stressed in that area. And so initially, we did some assessments of the knee. Not much was coming up. There were some things that were tendon palpation, a few positive orthopedic exams that said maybe meniscus, maybe not. So it wasn't really clear at that point. So we went that one step further and we started assessing the lower back, specifically the lumbar vertebra with the facet joints as well as the SI joint. And on actually both sides, her SI joints, when we tested those with multiple different orthopedic tests, that reproduced the pain that she was having in her knees to a T. So when we put her in those positions for the testing, she hollered out, "That's my pain, that's my pain." And so, this just stresses the importance of making sure that you're also looking upstream and downstream of where the problem is, and not just treating where the pain is perceived, because that's not always where there's damage. Now in her, it's possible that she also has some osteoarthritis in the knee and maybe some meniscal injury that could be a contributor to her pain. So we're not disregarding the knee, but we're just making sure that we're assessing other areas and then appropriately treating those other areas in order to fully resolve the pain. And so for her, we ended up doing some myofascial work today with some acupuncture, just trying to get her pain levels down a little bit. We're priming her to get some prolotherapy next week. And so just kind of starting that process to get her body ready for that. And then next week, we'll be doing prolotherapy to the SI joints to create more stability in the joints, mainly through addressing the ligament laxity that she has, and then also kind of calming down some of the inflammation inside the joint, as both of those could be contributing to the pain that she feels, again, in her knees. So moral of the story is make sure that you are not just looking where the pain is, but you're also looking elsewhere, because the pain, where you perceive the pain, is not always where the problem is. And that's all I got for today, guys. So I hope you've had a wonderful day. Please like, subscribe, and comment, and share this with anybody that may be suffering from something similar. I would love to help them out, and I'll see you guys next time.